I've had a lot of sinus congestion,
Uh-huh.
which kind of on the plane translated into impaction. I don't know if
Yeah.
I want to say infection, just pressure, you
Yeah.
know, and that kind of a thing. So I can't seem to get this side to release. So I don't sound good.
Try
I'm a
like
little
neti pot.
woozy. It can't neti pot when it's that congested, but I've been doing stuff to get it to
Okay.
drain it. Just I think there's allergies,
On top of that?
congestion, yeah, and then I fly, and then I go in a hotel, and
Yeah.
it gets dry. So I'm just kind of in that cycle,
Mhm.
and you know, other than that, you know, just
A nice thing to
figuring it
take
out.
on the plane is some saline solution.
Yeah,
Because it's recirculated air, it's super
Right.
dry, dries out your mucous membranes,
Mhm.
and now bacteria can thrive.
yeah,
So you keep them nice and wet. That's what I do.
yeah. The person sitting next to me loves it when I shoot saline up my nose.
Yeah.
Sitting in the seat, they're usually really amenable to
Get
moving
over it.
after that.
Come get over it. Come on down.
Yeah, see what's going on? A little tight in the low back, a little tight down here.
Uh-huh. And what do you think overall since we started?
Things are shifting. I mean, it's amazing to feel changes.
It is pretty amazing. It's
My
amazing to
pelvis
see.
is the most resistant.
Right. Well, everybody has their primary area. You know, in
Mhm.
chiropractic, they call it the primary subluxation.
Mm-hmm.
I honestly don't know where it comes from. It's just that it's there. For me, it's between my shoulder blades. For you, it's your pelvis. For other people, it's the neck.
The origin story.
Yeah. Do that, make a Marvel movie, Tyro Man.
Mm.
Turn towards me. I'm convinced that like a lot of the chiropractors who post the YouTube videos enhance.
The crack.
The
Yeah,
audio.
well, we were talking last time about the crack isn't necessary for you to know if you got the adjustment,
Exactly.
and it's your fingers that, and I think that's so important to realize. That's just a byproduct of the whole thing.
Yeah, exactly.
Oh, well, we haven't had to enhance it.
Not that one. Not that one.
Hasn't been an issue in our videos. Oh, see, this hip just likes to get me fit.
Yeah. Any yoga poses you notice are restricted from the hip?
Yeah, like it's you know, anything where I'm having to get, you know, like Anjanasana with like one leg forward, one leg
Mhm.
back. I just notice bringing, oddly though, this side's the side that hurts. I can't bring my left leg all the way up between my hands in one fell swoop. I have to
Mhm.
help it up.
Right.
I just can't ever get it all the way up there because of the restriction on this side.
All right. We want something to watch for. As the pelvis starts to line up, you should become more functional.
Shouldn't I?
Should.
Last time you were talking about how the muscles are stupid. They just listen to
Yeah.
the brain.
That's right. That's right.
And we found that really interesting with, you know, respect to the restrictions we kind of put on ourselves or that are in our minds.
Totally. Totally. So much comes from the mind. You know, that's the triad of health in chiropractic, the physical, chemical, mental. I think the mental is the most important.
Yeah.
Lovely. Power's on.
Power's on. So, it was Hamilton Morris that talked about Ambien.
Okay.
And that when people took Ambien, like it's just a weird drug,
Mm-hmm.
and that when they take Ambien, they can come out of a coma, they can walk when they're paralyzed,
Wow.
like temporarily. It was in this interview with Joe Rogan.
Huh.
Like temporarily, they have this crazy ability to do what medicine says they can't do. Now,
Wow.
of course, you can't stay on the Ambien because the side effects are profound.
Right.
But to your point about like the muscles are stupid, what is Ambien doing that in that moment somebody with bilateral paralysis can suddenly stand up
Right.
and move
Yeah, that's incredible.
or come out of a coma?
Yeah, it means modifying brain chemistry. right? It's
Insanity.
just different stuff coming down. It is crazy.
Insanity. One more question. Do you feel that chiropractic helps people with depression?
Sure. Yeah, that's well documented.
It's well documented.
Yeah, for sure. It's almost, when there's misalignment of the top two vertebrae in the neck, it's almost like a bottleneck. There's 300 trillion messages per second going up and down. When these two are blocked, it's almost like gridlock in your brain, because the messages are, massive amounts are being blocked from coming down and coming up, and it's like your brain is struggling to try to take care of it, but it can't, and I think it pulls away from the cognitive faculties, changes your thinking.
Maybe we'll find some studies and we'll put some links.
That would be cool.
Let people take a look at that.
Yeah, I'll send you some stuff.
Yeah, anything that avoids those terrible medications for people is a much better way to do it.
Yeah, for sure.
No side effects.
For sure.
A smile.
Except for good health.
Thank you.
You're welcome.